Welcome. I am Angela, and tonight we are going to be talking about our healthcare plan that we have with Young Living. It was introduced last year in 2024. So, Young Living partnered with Clearwater to bring on a health share plan. So, we're going to be talking about health share versus traditional health insurance. I'm going to start with some of the comparisons, and then we're going to do a kind of an introductory dive to what are the specifics and the basics. So I started with Young Living 10 years ago, this last April, and I was in the medical field, so I've seen a lot of things behind the scenes, know a lot of things about traditional insurance, but I didn't ever really know much about health shares until last year. And for the first few months, 7 months specifically, is what it took me to really like even sit down and learn about it and understand what are the specifics and the things that I'm going to be teaching you guys about tonight. So, first, let's talk about what is a health share. So, it's a community of individuals that help cover each other's expenses. Our monthly premiums that we pay go towards the medical costs of the group. So Clearwater has been doing this for 8, I think almost 9 years, and they have an idea of what costs are and what amount of money needs to be set aside. So that's how where they set the monthly premiums and how they figure them out. Um, we pay an annual max. So we determine what amount we are comfortable with paying or covering in our medical expenses as something might come up for the year. And then after that, typically 100% of things are covered. So I like that part of it because it's pretty clear versus other like insurance. There's if this and that, and like what doctor are you going to, and those kinds of things that you have to look at and consider. You don't have that kind of thing with this. It's very clear and specific and straightforward of what is and what isn't covered. So who is Clearwater? Clearwater is a healthcare provider. They're a company that was established in 2018. So I guess I was doing the wrong math. It's 7 years, coming up on 8 years in a few months. But they're not a traditional health insurance company. They are a nonprofit. So if you know anything about health insurance companies are for profit. The people who are the CEOs or the presidents or whatever they are at the top of the company are very wealthy. Their goal is to have profit and make money. With a nonprofit, if you're familiar with them and the requirements to be a nonprofit according to government standards, there are limits and caps on how much money can be made. And so it's a big thing that really is one of the biggest differences between this and traditional health insurance. And it's one of the reasons that our monthly premiums are so much lower. So, the reason that Young Living introduced this is because the co founder of our company is very passionate about disrupting the healthcare industry and a couple of things helping people to see that there is a different way and a better way, that healthcare can be more cost effective. And even when you have health issues, you can be proactive about them. And that's where the piece of our Young Living essential oils and supplements comes in for people who want them so that you can reverse or address or take care of the issues that you might be dealing with or facing. So, what are the comparisons? So, I talked about a little of this already. So, with the health share, we're a nonprofit compared to traditional health insurance is a for profit business. With the health share, it's again a community of individuals. But the third point here is a really big one for a lot of people. No network of providers. You go to any provider for whatever service that you're needing, as long as they're a licensed provider, the coverage is the same for all of them. So, again, a really, really big deal for some people because they can't find a provider or the provider that they like isn't necessarily in network. So, it costs them a lot more money. You don't have to deal with any of that here. So I love, love, love that piece of it. Deductibles, a little bit different. So if again you're used to traditional insurance, you're probably used to a deductible, and then you might have a max out of pocket. So a deductible is where you spend X amount of money, you do all of your coverage until you reach a certain amount, and then a max out of pocket is usually you have a split where you pay a portion or a percentage, and your insurance company pays a percentage for up to $10,000 or whatever that max out of pocket amount is. With us, it's different. You have an annual max. You choose one amount, you cover your major medical expenses up to that amount, and then after that, like I said on the last screen, it becomes shareable. So again, most everything is 100% shareable. Claims are rarely denied because with a nonprofit and the way our structure is, we want to make sure that people are happy and that they stay because as the organization as a whole depends on making sure that people are here and those premiums are actually paid each month so that costs can be covered. On traditional insurance, if you've ever had a medical situation, you know that it's the opposite, and that claims have a very high rate of denial and can sometimes be very, very challenging. um, a very large percentage of people who have major medical issues like a serious car accident or an illness or cancer or something like that, even when they have health insurance, that's one of the highest reasons in America that people file bankruptcy, is because they will never be able to pay off a bill that is hundreds and hundreds of thousands of dollars type of thing. So something to be aware of. Hopefully none of you have ever experienced it, but it's something to know, that's important. And again, one of our goals is to really put healthcare back into the hands of individuals so that we can make our own decisions, choose our own doctors, and be proactive about our health. I'll pause here and open it up to any questions before I jump into my family's example. If anybody has any, I'll give you a second to unmute. None? Okay. So, one of the things I talk about is the monthly premiums are a lot better, and a lot of people save significant amount of money. It's based off of age. So this is my family of four. Both of us are in our 40s. I'm 44, Garrett's 47, but it's based off of the oldest person that's going to be covered on the plan. We did the medical and the holistic plan. I'll explain those in just a moment. And we went from, with traditional health insurance, we paid $1,560 a month. And now we pay $955 a month with better health care. So you can see in that first line there in my example, the chiropractic with when we had traditional health insurance, it was covered. We did get visits, but it was 12 visits per year. And now it's 24 visits a year, and we can choose chiropractic or acupuncture for those 24 visits. With traditional health insurance, I didn't have acupuncture. It wasn't even an option. It was 100% out of pocket. That little man there in the picture, Keegan, when he was 10 days overdue, or more like 6 or 7 days overdue, I started going to acupuncture, and I paid cash $155, and I went 3 times until finally he decided to exit. But if I would have had this, it would have been covered and I would have been reimbursed for those visits. So, one thing that I really like. You can also see that our out of pocket costs went down. So, for our family, if we had had major medical issues, thankfully we never did, and we never reached that maximum in a year, we could have paid up to $16,300 a year. Now we max out at $7,500. So, we've cut that in half, significantly less. And even the same on our individual people, if there's just one of us that gets sick or has some sort of issue or accident. IV drips are now covered. I have to be honest, I've never gone to them because the closest place to me, I think, is like 40 minutes away. I do need to go check it out because it's a great way to, you get an IV, so it's a great way to get nutrients, liquid nutrients into your bloodstream. And it bypasses, like if you're taking supplements, then it has to go through your digestive system and your body processes it. You pee or poop some of it out. This is a great way to just get it directly into your bloodstream, and haven't done it yet. And I've had the plan for almost a year. So one of these days I'll do it so I can tell you guys about it. But I have a lot of friends, actually, I have a few friends in Texas that do take advantage of this and absolutely love this feature. Again, this is something that people are doing to be proactive about their health. This is not covered on any insurance plan that I have ever heard of. So it's a big deal. Telemedicine, that is something that is more common now, especially since COVID. You can usually have like a nurse line or something. With ours, it's included, and you actually can talk to a doctor. That's not always the case. There's no charge for it, so no fees. It's included in the monthly premium. The nice thing also is telehealth for mental health coverage. I haven't met anybody who has had that covered at no charge on their traditional health insurance, but it is on ours. So it is like a specific program where you would log in, you'd get assigned a provider. I have two friends that have used this. One used it after her sister passed away unexpectedly. So to kind of process that trauma, she had a few visits. And then I have another friend who uses it as a counselor for life. And uses it regularly. I don't know if she meets with him once a week or every other week, but she says it's easy. She has the same provider and it's easy to schedule her appointments. So they both love it. Um, and then the supplement coverage. So this is a big part of reason that Young Living partnered with Clearwater is because of that, being proactive, teaching people that they can do that. So my family has been buying essential oils and supplements every month for 10 and a half years, almost 10 years and 4 months. And prior to this program, it was all out of pocket. Now we get reimbursed as a family $75 a month for those supplements. And I always spend more than that. So I take advantage of that full thing every month. Whoops. Um, let's talk a little bit about chiropractic because it was covered, like I said, for 12 visits a year on my traditional insurance. And most insurances have either 6 or 12 visits. But what I find is that it is better coverage than what I had before. So, for example, I went to the chiropractor 2 weeks ago, I think it was, maybe just about 10 days. I went and had a chiropractic adjustment, the massage add on, and I got reimbursed $175 for that visit. If I had had traditional insurance, it wouldn't have paid for the massage add on, and it would have only paid for a small portion of my chiropractic visit. I always had it wasn't very good coverage when I would go for chiropractic adjustments. So if that's something that is important to you, this could be very, very good for you. And I love that option that is helpful for that because I mean, it's what we're about is helping people to be proactive about their healthcare. This is something that's covered on the holistic plan. I mean, there's two different options on the holistic plan. You can have the full, more advanced one that comes with the 24 visits, or if you're like, I would never use that, then you can do a reduced one that has a lower monthly premium that only comes with 12 chiropractic or acupuncture visits per year. So this is an explanation of those three plans. Clear Share, that's our medical plan. So it's our major medical coverage. This is for emergency room visits, hospital visits, like if you're in the hospital, if you need a surgery, other things that aren't your traditional planned items that are on the next category that are holistic. The holistic, there's a list, and I'll show those to you in just a moment on another screen. And that, so you can have these plans individually. Holistic is going to be that chiropractic, acupuncture, the IV drips, the supplements, your primary care visits. So there's a set number of visits that you can go to a major medical, or you can go to a medical doctor within the year. It's either 3 or 5 times that would then be covered on that holistic plan. So that's more of, I mean, you can go for anything. It doesn't matter what the doctor bills for, but it's more for like going for your physical and those types of things. If you get the flu, than that and you need someone. But also keep in mind, if it's something that's minor, it doesn't have to count towards one of those visits. You can use the telehealth and get something that's needed. Maybe you do have like, I don't know, red bumps on the back of your throat and you want a medication. You can get that through the online portion and not use one of those visits. So it's a nice thing as well. Um, then the third option is what we have. It's the medical and the holistic plan combined, where you can have both of those. And again, in almost every single case and person that I've talked to, that's more cost effective than having traditional insurance was for our family, right? We save $600 a month and have those better coverages. A few things that are talked about here is that remember, there's no network. You choose any provider that you want to go to. um, what's covered under the ClearShare medical portion. This is a more detailed list. So like I already kind of talked about, accidents, emergency room, hospital, you've got the other telehealth and the virtual mental health program. But pregnancy, whether you choose home birth, birth center, or hospital birth, all of those are covered. And any postpartum care that's needed, and then something to keep in mind is that the person cannot be pregnant at the time that they sign up for the plan. So that's an important piece that I like to make sure that I mention, because I had a couple of ladies that were pregnant recently that wanted to sign up and get the plan. Home health care, pain management, hormone therapy, medical supplies, nutritionist. I mean, you can see this list is pretty extensive. Speech, massage therapy, hospice care, weight reduction. So really just about anything that somebody needs. It's just like medical coverage, but it's not governed by the government. It's a nonprofit. So there are the differences in that. I do want to point out one thing, the care coordination department. So this fifth bullet here on the left, the last one that is bold, is care coordination. So this is a department within Clearwater or ClearShare that helps to process invoices if you do have something that's major medical. So a surgery, you go to the emergency room, you are in the hospital for something, you would get an invoice, which in the medical world is called a super bill, and that's what you'd submit, and you'd open up a claim, and they actually help to get like discounts or reductions, help pay towards that, and are kind of the in-house place for processing, because again, it's not traditional health insurance. A lot of times your provider is not going to send the invoice for you. You have to get that, and it's a super bill is what they call it, but you're going to get that, and then you're going to do the submission for them, instead of the doctor doing it. But this care coordination department, if you have something that's pre-planned, like a hip replacement surgery, then you would go to them and ask them to help you do research and make sure that you're getting the best price beforehand. So they do this, they open a claim, they do the processing for you, they look at it. And there was an example of a gentleman who did need a hip replacement. He had the annual maximum that he had chose was $5,000 out of pocket. So he would pay the first $5,000, and then the sharing would take over from that. And because he used this department and needed this hip replacement at the hospital where he was planning to go, the cost was going to be $80,000. When he found out, or the department for him found out, the same doctor does surgeries and procedures at a surgery center, and the price there was $40,000. So, duh, of course, he switched, had it scheduled at the surgery center, to save the organization $40,000 as a whole. And in that type of situation, you use care coordination. They're able to find something that is good, and you take advantage of it. You don't have to pay your annual max for that procedure. So this gentleman didn't have to pay the $5,000. He got his hip replacement for free because he saved everybody as a whole $40,000. So it's not required. It's totally optional. He could have gone to the hospital. He could have done it for $80,000, and it still would have been paid. He would pay his 5,000, and then it would have been shareable at 75. But that's a way that people are encouraged to use that department. And again, be proactive about looking at costs so that we can, as a whole, save money. Anybody have any questions on this? I like to tell that story on this screen and stay paused so that you can take a screenshot, you can look at the details and ask any questions about the coverages. What I'm talking about as well, one of the things that I'll mention on another screen is, or maybe I'll just mention it now, is that with the medical coverage, if you have a pre-existing condition, it may not be good coverage for you. So if you have cancer or have had cancer, you need to have had a clean bill of health for 60 months. So 5 years before that specific a diagnosis would be shareable within the organization. Other things though that might be is like if you have a existing wrist problem, or you say you have carpal tunnel or something like that, you wouldn't be able to sign up for this and then 2 months later get carpal tunnel surgery. So it would need to be 1 year of time before something like that becomes shareable. And I've had people who have an existing condition that, because their health insurance was going to be too expensive and not they weren't going to be able to afford it or work it into their monthly budget, they still chose this. I actually have two people, specifically, they're getting ready to come to, at the end of the next few months, are coming to the end of their 1 year time frame. Thank goodness they're both stayed healthy and they've been proactive about their health this year. But it's something for you to be aware of. So if you have something, when we open it up to Q&A here in a couple of minutes, you're definitely welcome to ask about those. But a couple of things I will point out: diabetes, high blood pressure, high cholesterol are three that I can remember off the top of my head. As long as those are regulated within normal limits with blood tests when appropriate, like diabetes, if you have A1C that is within normal limits, by having medication or diet, exercise, you're able to regulate it. That is not considered a pre-existing condition as long as you have not been hospitalized for it in the last 12 months. So we can talk about those specifics. And if I don't have the answers, I have an expert on hand who is an employee at Clearwater, because I am not an employee at Clearwater. I work with Young Living. That's my partnership. But she answers questions. She's great. She is in Florida, so it's 9:20 at her house. So I won't text her tonight, but I could get answers tomorrow. So let's jump in and look at the specifics on the holistic plan. So the holistic does not have any pre-existing conditions. It's very clearly defined what is covered. So this can be a great plan for somebody who has health insurance that they're going to stick with, because maybe their employer pays for it. Maybe they have something that doesn't cost them very much. Maybe they have a pre-existing condition, but they want to be able to be proactive about their health. This can be great for them. So the Young Living supplements are covered $50 a month for individuals, $75 a month for couples and families. The primary care visits would be 5 visits a year on the full plan, 3 visits a year on the more reduced or limited plan, which is called holistic savings. Breast imaging is on this plan. So another thing that I like about this, you can choose thermography or mammography. If you're familiar, thermography doesn't have the radiation that mammography has. And if you're sensitive to that and you don't want radiation, thermography can be a good alternative. But again, usually not covered by insurance. I've never known an insurance that it's covered by. I personally did thermography, started it about, I think, 6 years ago, maybe 7. And I would just pay cash because I had insurance, normal insurance then, and it wasn't covered. So um, and then chiropractic, acupuncture, IV drips. And now on this one, prescriptions are covered. Um, the generic prescriptions, most of them are covered and they're $0. So no out of pocket costs there. If it's a name brand, it depends. And so we would look at those and we can proactively check those to see if there's something that might be an issue or a concern if you're transferring over to that. And then I've got a couple of other options that I can help you if there are any medication issues or challenges, because I've been in the last 2 weeks doing a lot of research for one of my friends on that. Any questions on what's covered here on holistic? On the holistic items on this list, when you are getting these services, it would be like you're a cash pay patient. So you buy or pay for the service, you get your receipt or your super bill. So super bill for chiropractic and acupuncture, and you submit it and you get reimbursed. You get reimbursed everything except for what's listed here. So for example, primary care visit, let's say the visit is $170. You would submit that super bill, and the first $20 is our responsibility as the patient, and we would be reimbursed the other $150 right away. Um, right now, the reimbursements, like I literally just submitted not my chiropractic, my acupuncture that I had on Friday, and within 24 hours, so I submitted in the evening. The next day, I got the confirmation that told me it was accepted, it was being processed, the amount I would get in my reimbursement, and the date it would be in my bank account. And it's usually about 10 days out. Now, I will say, at the end of the year, there are more people that are, oh crap, I want to go make sure I take advantage of all my visits and do all the things before the end of the year and it resets. Um, and so they did get behind. Last year, it actually took about 7 weeks. So it took a long time. I think that was in like October, November, and December. But most of the time, they say that it's going to be within 30 to 45 days. And typically, it's been like confirmed in 24 hours and I get my reimbursement in 7 to 10 days. So been really, really fast. Here's the holistic savings. So you still get the essential oil and supplement reimbursement. Primary care visits, like I said, goes from 5 down to 3, and you have chiropractic and acupuncture at 12 visits per year between the two instead of 24 between the two. It doesn't include breast imaging, it doesn't include the prescriptions, and it does not include the IV drips. So those are the differences in the plans, so that you have a lower monthly premium. So like the holistic savings might be good for a male that doesn't need the breast imaging, or maybe, I mean, men are supposed to get it too, so I don't want to say they don't need it, but you know what I mean. um, so now let's talk about pricing. as I mentioned, there's the three different options. This is the ClearShare plan. So this is for people who want medical coverage only. They're not concerned about the holistic side of things. They only want something if there's a major medical situation. And so then they would choose, am I comfortable paying the first 1,000, the first 2,500, or the first 5,000? For my family, we did 2,500. And then it's based on, as you're looking down through the different categories, it's based off of age and then what your classification is. Are you a single person? Are you married? And it also covers cohabitating adults, so you don't have to be married. If it's somebody living together, are you single with children or family with children? So, for example, if you are in the age of 50 to 64 and you're a single person and you're comfortable with a $5,000 annual max, your monthly premium would be $255. Any others? I'm going to stay on the screen for a couple more seconds. You can take a screenshot. If you want the recording, I can also send you a recording because I know some of you are joined on your phones, so it's hard to see because it's, unless you're zooming in on it and that. Okay, we'll go to the next one. So here's the holistic plan. So this again is somebody has their own insurance, they have a pre-existing condition. So this is a good one. I have a couple of people that are military, and so if they have something major medical that happens, they are going to use the military. They'll go on base, whatever it might be. But the holistic plan makes sense because they want to be able to go to whatever chiropractor, acupuncture. They want the supplement and oil reimbursement. So it kind of depends on people and the situation. Also, if people are over 65, I forgot to mention that on the last screen. They're over 65, they can have this as an add-on. A lot of people, when they have Medicare, they'll do a supplement. This can act as that because it gives them all the things, the doctor visits, acupuncture, chiropractic, and all of that. So it's even a little better than most of those. Holistic savings and ClearShare. So if somebody wants the medical and the basic, again, I don't want to stay on these too long. You're welcome to unmute if you want me to just tell you what's in a category and you can't read it if you're not on a big enough screen, or you can take a screenshot. Okay, next one. So this one is somebody who wants the full holistic and the medical coverage. For example, one of the people that I just enrolled was I think is a family of 4, and they're in their 30s. So, and they did a 2,500. So a family with kids, 2,500 in that age range of 30 to 39 would be $866 a month. I think I heard somebody unmute. Did somebody have a question? No? You guys are so easy. Okay. So one thing I do want to point out is the annual max for families. So as you might have saw on my screen, we're a family of 4, and our annual max at the 2,500 tier is only a total of 7,500. So it's not 2,500 per person up to how many ever people you have, because ours would have been 10,000. Ours is, it caps at 7,500. So it's lower. And that's even if it's a family of 5, family of 6, whatever it might be. So if you or someone you know is a large family, this typically makes a lot more sense to them, more than others. I mean, I think the biggest family I've enrolled is 5 people. But still, the larger the family, the premiums don't go up, the annual maxes don't go up. So it makes more and more sense because their healthcare does. Like, it's per person. They pay a fee. Children are less, but they still pay a fee, and it gets to be expensive. I have one person um, that was paying 2,400 a month for a family of 5. It's crazy amounts of money. It's like, what the heck, for her traditional insurance? And they had ridiculous out of pocket expenses. It was like $20,000 a year or something crazy. So, okay. There are options also for vision and dental. 6:30, so I want to make sure I pay attention to time. I promised that it would only be 30 minutes. So there are options for vision and dental. For my family, it made sense for us to keep our other dental policy, but we did switch our vision and have this vision coverage. So they can act individually, or you can combine them and do both. It totally depends. Again, this is the one where we usually look at what are your current coverages, what's the monthly premium, and a lot of times it's a separate policy from your traditional insurance. And so it's easy to keep it and only cancel the traditional insurance. Cool. So how does it work? This is Young Living supported. It's a combination of Young Living and Clearwater. So if you don't have a Young Living account, first thing you would do is get a Young Living customer account, because when you enroll with Clearwater, you use that customer number to get those prices that we talked about, to make sure that you get your supplement reimbursement and get the max benefit of it. But everything else is really done through Clearwater. So you sign up for the health plan there, you pay them the monthly premium. That's where the customer support and help is. That's where you upload your receipts, whether it's for your Young Living product reimbursement or a regular chiropractor or medical visit type of thing. So super simple, very easy. I actually have a friend that's joining here in a couple of minutes that I am going to Zoom with her, and we're going to do one of her reimbursements. But I'm to the point of where I almost have it memorized, and I can just go through it, and it's less than 5 minutes. So I save the receipt on my device or my super bill, upload it, and it's super simple. So whenever you or a friend is ready to get started, we can get you coverage started on the first of the next month. So if somebody wanted coverage to start on September 1st, they can enroll through uh, August 31st. And it's usually, I say, by 5 p.m., just so that it's in the system and all of that. They don't actually get invoiced by Clearwater until the 10th of the next month. So September 10th is the day that we pay for coverage that starts on September 1st, and we can go to doctors and go to chiropractor and get reimbursed for them starting the 1st. So super simple, super easy. Um, that's what I got for you guys. So thank you for being here. Does anybody have questions? Let me check the chat. So I see there's stuff here. Oh, cool. You guys were just telling me you could hear me. Good stuff. No questions? I guess that means I covered it really, really well. So if you have any friends that you thought of tonight, I do these Zooms regularly. My next one is Thursday. This week on Thursday, it's at 5 p.m. Pacific. I know there's like 3 of you that are at least from other time zones. So 5 p.m. Pacific, 6 Mountain, 7 Central, an hour earlier than this one. So I do try to change them up at the time and that to do some a little bit earlier, some a little bit later. I've done them as late as 7 o'clock our time, I think. So good stuff. Thank you for being here.